curious about your advice for a young student who is interested in pursuing a career in medicine. You know, what types of coursework that individual might take starting with college, and then thinking about ultimately preparing for med school, you know, whether, you know, going right into med school or maybe taking some time and gaining some experience. You know, it's a new world out here probably from when you graduated from Penn State. I'm curious as to, you know, maybe some thoughts you might have.
Yeah, medical education's changed a lot since I graduated. I graduated medical school just a little over 20 years ago. And back then it was get your undergrad prerequisites, take your MCAT, apply to school, go to school. And you know, medical school had 2 years of bookwork / basic science, then 2 years of clinical science, then you graduated. And now there's a lot more of, sometimes there's a problem-based learning, sometimes there's integrated clinical in the first 2 years. We had a little bit of that in my school, but ultimately, you know, the 4 years of medical school has changed a little bit. But as far as, you know, how to get there, it's still, you know, it's very competitive. So you have to look at what the schools are looking for an MCAT score, which has now been retooled since I've taken it. There are going to be basic prerequisites, but the avenues that you have now to get to medical school are a lot more broad-based than I had. You know, we had biology, physics, chemistry, organic chemistry, pre-med were kind of the main ways to get there. And I ended up with most of a biology major, all of a HPA major, and then a Japanese minor for what it's worth, and then some night classes to wrap up the prerequisites, and there I went. But with now in the Health and Human Development College, the, you know, biobehavioral health, and a lot of the allied type or global health, global medicine, these are just amazing opportunities, I think, that you can get into. Now, you'll probably still need to take a few ancillary classes, physics, organic chemistry, things like that, that may not be part of the BBH degree, for instance. But I think it gives you a lot better opportunity to plug into the if you will, the new medical school training environment that is out there. So I think my advice would be, looking back now, 20 years out, my advice would be look at the medical schools that are out there first that you'd be interested in applying to and what their curriculum and course load is like. And then adjust your undergraduate career to kind of fit that or emulate that, keeping in mind that there may be a little bit more coursework you need to take. But internships and actual experience on top of your coursework is always a big plus. We have the Amarillo School District has something called the PRO program, and they plug a student with you for a year. And I volunteered for that a couple years in a row. And I've had 2 really good students that have come through. Both have sights on pre-med and want to go into medical school. And one was a young man who was a local, you know, kind of born and raised here. His dad was a patient of mine and introduced me to him. And he formally applied through the program to do this. And every day for a year, he basically would come for about a half day and just rotate through clinic with me, follow me in the hospital, see procedures. I think the school had a great idea in mind, maybe a little bit hypersaturated with the length of the program, but still, you know, he became a fixture around the office, got to know everybody, got really comfortable with the healthcare environment, which was, I think, a plus for him. The next student I had the following year was about 3 years post-immigration from Syria as an immigrant. Her family had to flee, and they set themselves up here in Amarillo, Texas, of all places. And she rotated with me, very bright, very ambitious young lady, learned English 3 years ago, and is going to be a star someday. Again, with me every day for the year. I think maybe to their credit, maybe they could have rotated them around and gotten them a little bit more broad-based book, but they're high school, so they've still got plenty of time to look through other things. But again, it was an interesting program, and I think there have got to be things out there at the undergrad college level like that, and if not, then that would certainly be something to work on.